Hello, and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Zachary Schwartz. In this series, we'll hear from a variety of patients and patient advocates as they discuss their perspectives on barriers and solutions to HBV care in the United States. In this episode, we talk to 3 Asian American patients. We have Melinda Tran, who is living with HBV. We have Dr. Thuan Vu, who is a rheumatologist living with HBV. And we'll start with Jennifer Wild. She's a registered nurse living with HBV.
So let's start with HBV screening and diagnosis. I'd like to start by describing myself and my brother as a case study. We were both born in an endemic area of the world. We were born in Korea in the 80s, and we had unknown family HBV status at the time of our adoption, meaning that when we came to the US, we didn't know if our biological families had infection. When we both arrived in the US, as infants, we received our HBV vaccines in early childhood without actually having surface antigen testing before we got our vaccines. I think this kind of led to a sense of false security that we'd been vaccinated and presumed not to be chronically infected. So next, I'll talk about some barriers I think that perhaps my brother and I encountered. First is patient awareness for myself and my brother. We both are fortunate that we came from educated families. Our parents are educated. We both were able to go to college. We had health insurance even before the Affordable Care Act. We both were covered for medical care, and our parents had stable income. So those weren't barriers, but we still weren't aware of the risk. Another barrier perhaps may have been that my family practitioner, our primary care, didn't seem to be aware of the risk, despite their own education and training. In retrospect, I think it should have piqued their interest, perhaps, that, well, these are 2 children that were born in an endemic part of the world. We should just screen them. And I think perhaps a third barrier is that willingness and motivation to seek care. So even after I learned of my HBV status as a result of my occupational health screening, because I'm an RN, and I shared that information with my family, both my adoptive parents and my brother, the rest of my family wasn't super eager to get their own testing done. I think there may have been some thought of, well, what difference would it make if I already have it? What's the point? It doesn't change anything. Eventually, my brother did get screening later in his middle age and did get linked to care and treatment. But there's that delay, and there were those couple of years where I would just worry. I know that in my oncology practice and GI medical oncology, where I focus on hepatobiliary, I have many patients every year who come to our oncology clinic for care, newly diagnosed with fulminant multifocal liver cancer, who also at the time of their cancer diagnosis learn of their HBV diagnosis for the first time. And so it really scared me to think that could be my brother, that he could be one of those patients who doesn't even know their status for so long. But eventually the willingness and motivation was a barrier that we were able to overcome.
And thank you for having me be part of this roundtable to talk about hepatitis B diagnosis and treatment in especially Asian community in the U.S. And as you all have been aware that although hepatitis B is less than 1% in U.S., however, for the Asian community, it's about 10% plus minus. And it can be a huge issue for our community. And one of the issue about diagnosis and correct treatment is the barriers. And as we talked about this and did more reading about literature, one of the main barriers besides like healthcare resource, community service, maybe financial support, is that there is a social stigma. When we are labeled with hepatitis B infection, which can infect other people, sometimes we are a little bit embarrassed or we want to not say about that. It's an embarrassment. We don't want to be isolated. We don't want to be labeled having hepatitis B. So all those things are innate in the way we think of ourselves. And that may be one of the reasons that sometimes the doctors may recommend this, but the patients don't want to pursue that. So, for example, in my practice, sometimes I'm aware of that and I check the test and it came back positive. And from that point, I talk with the patient and let's do this, let's do that, including referral to the specialist. Sometimes I feel a little bit reluctant in the patient. We know that sometimes there are some barriers about like insurance coverage, financial support, and or lack of Vietnamese-speaking physician who can talk about hepatitis B. A lot of my patients who are Vietnamese, sometimes they don't speak fluent English, and sometimes they don't have members with them to the doctor's office to translate. So there's a little bit of reluctance from multiple factors. However, back to the story. I myself was diagnosed of hepatitis carrier, and I went for treatment. And after several years, I'm in remission. But at the time of the diagnosis, as a physician, I read everything about hepatitis B and the association to cancer. And I was very scared.
I think it's great that even though you're a rheumatologist and HBV doesn't necessarily come up perhaps on your regular expected plan of care probably as much, that you're screening for it because of your experience as a Vietnamese American person. And you also bring up, I think, some overlapping themes that we're starting to see, which is about kind of that psychosocial and emotional willingness and motivation, like in mind, the screening, how there's like a fear of knowing the status. And then it sounds like even after a person does know, that perhaps the fear of the next steps can delay linkage to diagnosis.
Mm-hmm.
Melinda, what would you like to share anything about Dr. Vu's discussion?
Yes. With his discussion about the fear and the embarrassment of being screened and finding out that you're, positive for hepatitis B, I think that plays a big role in terms of people not wanting to know. They'd rather be unaware of it than being aware of it and then having to face that embarrassment. And I think we just need to somehow have a campaign to overcome the fear of that embarrassment, because I think the risk is too high, to let your embarrassment get in the way.
Yes. And thankfully, I think linkage to care at least may have improved after the Affordable Care Act. Insurance can certainly be a barrier, but what might be some solutions to some of the barriers we've talked about, if as far as linkage to care, if people do not wish to seek a specialist, if people aren't, for whatever reason, getting that connection, what are some potential solutions for that?
Well, as I think about, because I've been attending some of the health fairs, I think in the community, for example, church or temples or community health fair, it would be great if we have young volunteers who can speak both Vietnamese and, for Vietnamese community and English, to have some training about hepatitis B and its risk to leading to cancer and other issues, to communicate with the community on those health fairs. And that would be a great start. Make it like it's okay to talk about that, and it's good to have it screened, and it's good to have it, if it's positive, seek treatment.
That's a really good point. I often forget about community centers and the health fairs they sponsor. Those can be really impactful.
Well, thank you very much to Dr. Vu, to Jennifer, and to Melinda, and thank you for listening. To hear other episodes in this series, see the show notes or go to the Clinical Care Options website. Thanks for listening.